Hi, today I am going to present one topic which has been requested by one of my very special subscribers regarding the hoarseness of voice or hoarse voice. Hoarse voice or hoarseness of voice is a very disabling condition, and it gives a lot of anxiety to a patient. Nowadays, because of fear of cancer and any other very serious diseases. But is it really very serious? In most of the time, let us try to know. First of all, what is hoarseness of voice? Hoarse voice is when your voice becomes raspy, ready, and your sound is changed. It may be lower in pitch, or it is, the intensity is reduced, and your voice cannot be heard by other people. So that is how we come to know that we are having hoarse voice. Okay. So how voice is produced? First, let us try to know. We have got two vocal cords here in the larynx. Larynx is the structure having the voice box. It is also called the voice box. Here the voice is being produced. It lies just below the tongue, beneath the tongue, from here and above the trachea, that is the windpipe. And this in the outside is visible, especially in male persons, here as the Adam's apple. So when you touch your finger here and you speak, you will find a vibration of your speaking. So we have got two vocal cords, and these two vocal cords, as I am also showing in the picture on the side, these two vocal cords are nothing but some soft muscles, and covered by the soft skin called mucus or mucosa. So these vocal cords, when we breathe, they are wide apart. When we give voice, when we speak, they come in closer together in the midline, and we try to exhale. And all these are orchestrated action by our brain or our brain stem. See, the chest starts contracting and the voice is produced by pushing out air through the bronchus to trachea, then through the larynx and in between the two vocal cords. Then this airflow produces vibration of the two vocal cords, which produce the sound just like a reed instrument. And this voice is being modulated by our throat, then oral cavity and nose cavity. And as you know, the size of these structures are different from one person to the other. The voice is also different from one person to the other. So somebody always have a distinct voice. So you can always recognize somebody's voice, which is very special. So how this hoarse voice occurs? There are so many causes which will come later on, but when to go and visit a doctor? Suppose if you are having a hoarse voice for more than 3 weeks, and which is not related to any catching cold or misuse of voice, let's say during shouting, especially during the election period, and when you are doing some business of shouting and all those things, it may produce some misuse of voice. If it is nothing like that, but if a person is having hoarse voice for more than 3 weeks, and sometimes if not even 3 weeks, but associated with blood coughing, breathing problem, respiration problems, and pain while swallowing or pain while breathing or speaking, if you are having such a problem, you have to approach a doctor. So you can approach any general physician, but the physician, when he sees you, he examines you, then he will think that there is something wrong in the vocal cord. Then they will send it to the ENT surgeon. In myself, being an ENT surgeon, how we examine a patient, how we diagnose a patient. First of all, we would like to take a proper history. When it started, how it progressed. Is it recurring? Means there is gaps or days of days when you are very much normal, having normal voice in between. So all this history are to be taken first. After that, for proper examination, a flexible nasopharyngoscope is needed, for which we pass it through the nose after giving some anesthesia, local anesthesia. It is just in a cotton, we just shock it and put it in a nose cavity, and after some time, after 2-3 minutes, this area will be anesthetized. Then we can pass the nasopharyngoscope, and it enters inside, and from the tip, you can see it. Once the tip goes inside, you can see the movement of the vocal cord and its structure. I'm also showing one video side by side. So if you find a person to be having hoarse voice, so what are the causes? The most important and a common cause is laryngitis. That is inflammation in the larynx, that is the voice box. This usually occurs when you are having cold, catching cold, and any infection in the upper respiratory tract. Beyond that, there can be some other causes like say reflux, which has got two types. One is LPR, that's Laryngophilia Reflux, which is seen by the ENT persons. Here you may not have any heartburn, any stomach burning you may not have, but still you are having say some coughing, sometimes choking to food, and when you are also having a sense of frequent clearing of your throat, you feel like clearing your throat very much. So like this, you may have some of these problems that you have to approach, then it can be diagnosed. Another cause is when you have misuse of voice. Say for example, somebody shouting because of anxiety, or because of say any other, in some conditions you will find it during the elections when people shout and like that, and also when hawkers, when they shout and for selling their products and all, suddenly they may become, and even in case of the teachers also who are teaching in schools, you may have some hoarse voice. At the same time, some ill-trained vocalists also may have some problem in the voice. So in those cases, the hoarse voice can also occur. This is due to misuse of the voice, and there we have to see whether the voice is misused. In those cases, if there is a trauma, then we have to explain to the patient how to use the voice, and he may even be treated by a speech therapist. Next, there can be many other growths or many other benign lesions in the vocal cord. Say for example, vocal papilloma, then vocal polyps, then some nodules like Singer's nodules, then there may be granulomas in vocal cords, vocal cord cancers, then subglottic growths, polyps, and all those things in the vocal cord. Beyond this, because of there are some other conditions where you may have hoarse voice, like say in some thyroid problems, some thyroid tumors, thyroid cancers, cancers of the lungs, then cancers of the throat, all in this cancer of the larynx. In these cases, you may have voice problem also. Beyond this, a person may have hoarse voice only when the thyroid hormone is also not in the proper state, proper normal state. Like in hypothyroid, means thyroid hormone is low. In those cases also you may have this hoarse voice. Beyond this, there may be paralysis of the vocal cord. Because vocal cord, it should be tense and should be in the midline, so that any air passing through this will produce some vibration. But if the vocal cords are lax and they are not moving because of paralysis of the vocal cord. These are some neurological causes, some local causes of cancer, and the affection of the nerve supplying the vocal cord. So in these cases also you may have hoarse voice. So if you are having hoarse voice, if it is more than 3 weeks, then you have to approach a ENT surgeon or a physician to diagnose the case. You have to bring proper history to the doctor. You have to tell everything, how it started, how it progressed, for how long you are having it. Now another thing is, you should not be afraid about any voice problem, and you should never think that it is only cancer. So it can be something else also, but best thing is that you have to report it as early as possible so that it can be treated properly. So this much for today. So when you are having hoarse voice, you know how hoarse voice can occur. So now you will be well, informed about this. So whenever you have problem for more than 3 weeks, then you have to approach a doctor. Thank you very much for listening and for supporting my video and my YouTube. Thank you very much. Bye bye.